Glaucoma is not a recurrent type disease. It is a progressive type disease. That means uh, once a glaucoma has developed and then after treatment it is totally cured and again it is recurring. That is not the case with the glaucoma. It is a long standing and progressive in nature. So we have to consider the clinical condition when the patient comes to the treatment, whether it is in the early stage or in the late stage, like that. And also some other factors are to be considered, that whether he is under treatment for already under treatment for the disease, and whether any deep level treatments like surgical procedures and implantations has already done. These are all considered during the treatment. Any disease has its own trigger factors. That means some factors will be triggering that pathology. Glaucoma also has such conditions. For example, eye strainful works, especially on screen works. Then sleep pattern, work in the night and sleep in the morning time, like that. And the food changes, and also changes in the food pattern, and like that, and stress, mental stress, and even professional stress. All these things are factors which will trigger the eye disease, especially a chronic long-standing disease like a glaucoma. So the first step of the treatment is to avoid these trigger factors, but it is not at all possible in the present scenario of lifestyle. So the thing we have to do is to make this structure more strong or healthy so as to shoulder all these burdens. For that, boost up level treatment will be necessary. That is why we always prefer to have the treatment in a particular period so that we can keep up the stability or keep up the functional capacity of that structure. So it is better to have an inpatient level treatment within a particular period, maybe after 6 months, or that depends on the this chronicity and severity of the disease. Anyway, a boost up level treatment will be recommended. That is my experience.